My name is Andrea, and this is my healthcare story. I have worked as a sound editor and sound designer since 1996, but as of the beginning of 2009, I didn't really have enough union hours for my union healthcare plan to continue. Early this year, I had a regular physical exam scheduled, and shortly before that time, I developed a small bump next to my navel that was really painful. It arose literally in one day. I wasn't able to get an appointment for the surgical consultation for about 3 weeks, so I felt that it seemed pretty likely that this was not an extremely serious or life-threatening situation. Otherwise, they probably would have found a way to squeeze me in sooner. When I got to see the surgeon, the hernia had shrunken, decreased in size by itself, and it didn't hurt anymore. I had been planning to apply for private health insurance. I was very confident that I would be given that health insurance because I didn't have any major healthcare problems, and I've applied for private healthcare insurance at times in the past, and I've had no trouble getting the insurance. So I was really surprised when the insurance company declined my application. It happened that the insurance company that I was applying to private healthcare insurance coverage with was the same insurance company that the surgeon worked for. So I was especially surprised that even though basically what I was doing was taking care of myself and seeing doctors within the healthcare system, that then when I had a problem, which I was treated for or at least diagnosed and they suggested that I really didn't need any treatment for, that then that same insurance company would decline my coverage, just a few weeks later. However, a lot of time has gone by since then, and I really didn't feel comfortable not having health insurance, so I started to shop around and see if I could get another plan. I applied through another organization that was basically a Blue Cross HMO, and they declined my application as well, but then, thanks to the help of a note from that surgeon, they were willing to give me a short-term policy, which will end within 6 months. And you can be sure that I'm going to be really careful about whether or not I go to the doctor in the next 6 months. If it's not a life and death situation, I probably won't go, because I certainly don't want to get labeled as having another pre-existing condition before this next healthcare policy ends in 6 months. Will there be a healthcare plan for me?